Welcome to Adoptinkers, and thank you for deciding to watch this video. You want to know all the medication that you need to know for the integumentary system. I make it easy. I put them all together, straightforward fact about them that you need to use for your exams. Then we do practice question after the lecture. So after every lecture, practice question. So let's get to it. I'm starting with the sunscreen. All these ones are all teaching that you provide to the patient. And so the first one is what? Sunscreen. Okay, sunscreen. And all you need to know about this is their function. They absorb UV light, ultraviolet light. What do they do to prevent sunburn? Right? And there's two types of UV light you should worry about. The UV and B, which you should know that you're looking for anything that contains, we call it PABA ingredients that can destroy this. And what is PABA? I mean, you may ask, what is PABA? It's just a fancy name. It's para amino benzoic acid. So when you're looking at the medication for this particular problem, just make sure you contain one of those. And those sunscreen that will fight against the UVB is mostly the PBA esters or the cinnamons. So when you look at the label, they give you a question, cinnamons. These are the best ones that can do that. If they give you UVA, which is more stronger, yeah, you need the benzo phenols basically to help you protect that. What are they going to do? When you buy the medication, or if you're looking for the answer choice, you're looking for some protection factor, at least 15. So you can buy sunscreen and it does not have sun protection factor. Less than 15 is not good. What does that mean? 15% means it gives you 15 times better protection than without sunscreen. That's all. So if you go outside without a sunscreen, you're less protected, 15% less if you put a sunscreen in. That's what it means. 15 sun protection factor of 15 means you protected 15 times than somebody who does not have any sunscreen on. That's all. What teaching do you provide the patient? Straightforward, like apply 30 minutes to 60 minutes before going out the sun, right before the exposure. And then this is key. Reapply, okay, if you swim, if you sweat, now every 2 to 3 hours while you are on the sun. That is key. Reapply, not just one, but you got to reapply 2 to 3 hours. And this is all you need to know for your boss, okay? Just a little bit of sunscreen, put it on your skin, you apply it 2 to 3 hours. If you swim, reapply it. If you sweat, and that's all. And make sure it has 15% in sun protection factor. Like I told you, straightforward stuff. I'm not going to waste your time. Then the antipruritic, actually the name sound is anti-itch basically. This is how the pharmaceutical company make a lot of money. Anti-itch, you stop itching. And you know most of this already, right? Some can be topical or oral medication. So they come in different form. And most of them are antihistamines, right? Or steroid. Or topical steroid, right? They can be oral topical steroid. The common one, I know some people have heard about it, Adalas, and I call it, the rare name is hydroxyzine. Hydroxyzine, right? And this is oral medication and it's antihistamine. It can also be used as antiemetic. So it can, if you have nausea, the biggest problem is it's called drowsiness. So when you take it, you got to be careful. These drowsiness can be used as a good effect that if you have insomnia, yeah, you can take it so that you can sleep. So you can take it at night, and that will help you from scratching yourself during the night. And if you have sleeping problem, this will help you. The common one that we know is diphenhydramine. Everybody know about it. That one is easy, right? This is Benadryl. This is what we know as Benadryl, basically. And it has antihistamine and anticholinergic effect, right? So you know anticholinergic effect, they give you constipation, okay, dry mouth, and pupillary dilation. Okay, urinary retention. So just know the side effect about this medication because of anticholinergic. We also can make you drowsy, you know, so you got to be careful when you take it. Okay, so those are side effects of these medications. Of course, we have topical steroid, which is very common. Everybody uses it. You go over the counter, you see a bunch of topical steroid. Remember that if there is a high dose steroid, you can have systemic effect. And you have to bring your endocrine, you know, weight gain, you know, hypertension, all these signs of Cushingoid symptoms. We don't have to go through all of them, but you should know that topical steroid, if it's high dose, you can absorb some into your system and you can get effect. And therefore, you should not stop it right away, right? What is the teaching with the application of this steroid? What do you tell this? And then anti-itch medication. What is the teaching you provide? Teaching for pruritis. So teaching for pruritis. What do you tell the patient? I want you to bath more frequently. Okay, bath, bath so that you can warm your skin, right? Hydrate your skin. Okay, bath more frequently, but not excessive water. You can stay there for a long time. If you take bath in the tub, yeah, it's not good. I don't want you to do that. Just let water hydrate your skin, okay? And use tepid water. Okay, and then your soap has to be mild soap, okay? Try to have a like cool environment, especially if and this will help with sleep so that you don't scratch yourself. And wear some cotton dress, you know, and less fitting clothes. So less tight fitting clothes so that air can go in and help with that. You should trim your nails so that you can scratch yourself and injure yourself. But this is the teaching you give to somebody who, even if they have atopic dermatitis, it's the same thing you tell that patient. Somebody with atopic dermatitis, you can give the same teaching I've given you because of itchiness. So the same thing, bathing, mild and soap, tepid water, cool environment, cotton dress, light and fitting clothes, trim yourself and then your nail, and then ensure that you don't scratch yourself. That's all. And so this is the two types, sunscreen and antipruritic medication. Easy, straightforward questions that you can get from that. And so let's practice some questions. So this is the question. A nurse is providing teaching to a client with high risk of what? Skin cancer, right? On a proper use of sunscreen. Which of the following is a priority that may be included in the teaching? So all I'm saying is break down the question. It's a priority. Priority in the management of sunscreen when you're applying it. That's all. Sunscreen, what is the priority? Apply 30 minutes before exposure. That's good. Is there a priority? Maybe there's something better. Reapply every 2 hours. That's good. That's what you need to do, right? Must have sun protection factor of 15. That is good. Reapply after swimming. That's good. But you have to think prioritization is the most deadliest of all. Which one is the most important? You can use a medication that has sunscreen factor less than 15%. And you can apply every 30 minutes. It's not effective. You can reapply it again. It's not effective. You can reapply after swimming. It's not effective. The most important thing is make sure to protect yourself from injury is you have at least 15 sunscreen factor basically. So this is the most important of all compared to the rest. Okay, so 3 is the right answer. The next ones are Emollient and Lotion. Sometimes we see these questions and we don't know what to do with them. I'll make it easy for you. So lotions, we have different type of lotions, okay? Lotions can be a liquid or suspension. Okay. The suspension, you have to shake it. So you have to shake it before use. Okay, example is calamine lotions, okay, or zinc steroids. And this is just to hydrate your skin, but they don't do too much hydration. They're also protective in nature. The biggest problem with this, too much lotion may cause skin dryness as they evaporate. So that's even though they're helping you, they can evaporate and make the skin dry. So that's the problem with this. And that's all you need to know, that this is what they are, suspension and non-suspension. The Emollient are the one that is good for atopic dermatitis and other thing. And what does it do? This is going to fill the gaps in the stratum corneum. That's the topest layer of the skin after dryness, after it has dry, or if you have cracks. So they fill the gap and they help with that. So they fill those gaps, that cracks that you see on your skin and due to dryness. They make the skin really, really soft. After they do that, they make it soft and they hydrate it. Okay, example is like silicone oil. It's an Emollient, and or propylene glycol. These are example of Emollient, but they're very, very good. All these, I don't give you big side effect because they cause all causes small skin irritation if you've never used it before. That's all. So that's what you check for, but they don't have any major side effect. Okay. The protectant, as the name says, they protect the skin, right? They protect the skin from wetness or chafing and heat. That's all they do. So they're very, very good at doing that. So that's why example is a zinc oxide. This is going to protect the skin from too much wet or chafing. This is the medication used. The reason why I'm giving you, sometimes they give you a question, you don't know which product you need to use. This is the way to so that I give you the fact. I've distilled all information, but this is the key. And put petroleum, so that when you're choosing the answer, you know the function of the medication and what they're looking for. Okay. Then soaks for lotion, Emollient, and protectant. There's a key fact. Okay, key fact: apply after bathing while skin is moist. Don't completely dry yourself, otherwise you make the skin too dry. So this is a key fact. All of them you apply when your skin is still moist. Don't wipe dry completely. Soaps are very good because there's some wound that is whipping or oozing, but it's not infected or it's crusted. So you want to make it moist a little bit. You cannot put Emollient on this. A weeping wound, if you put Emollient, is not going to help you, or Protectant, which will not help you. What you need to do is to use soaks, and soaks can be closed or open, or wet dressing. And this has to be changed multiple times a day. Okay, the soaks can be open where you put a gauze on top of it and it's soaking the fluid out. Then the closed one, you put the gauze on it and then you put the tape on it. So you put a gauze and you put a tape and it'll be there. This can macerate the skin. Those that you put the tape can macerate the skin. So most of the time people use open soaks. And that's all you need. Lotion, Emollient, Protectants. Okay, so let's look at the question. One question. A client with psoriasis was prescribed Emollient. Which of the following which statement from the client indicate correct understanding? The medication will decrease my inflammation. It has nothing to do with inflammation. I will need to shake the medication before use. It's not a suspension. It contains zinc oxide to prevent chafing. That's not what it is. It's not a protectant, right? It's a protectant, but it does not contain zinc oxide. It is an emollient, but it can also act as a protectant, but it does not contain zinc oxide. It will make my skin soft and hydrated. That's what you do, making sure you wear hydrated as much as possible. So these questions are quizzes as we go on so that you can focus on the key concept, okay? Next question and next topic. So this is the next one, antibiotic, antifungal, and antiviral. As you can see, there's a bunch of them. We have topical for your skin. I can say, trying to make it easy, antibiotics. Straightforward, you know most of this. Mostly, they are against staph and strep infection of the skin. That's all. Example is like bacitracin, right? Bacitracin. You can have erythromycin, tetracycline, but I want you to pay attention to Mupirocin. Mupirocin is very, very good medication. I'll put this on it. We'll talk about it. Neomycin, tetracycline. These are all topical medication. They're not going to bother you too much, except a few ones I want to talk about. So pay attention to that. Bacitracin is the common one. You know, we all have it. You go to Walmart, you get it. It's for just minor cuts, okay, or irritation of the skin. It can cause irritation also, and you use it 3 times a day. That's all. 3 times a day, use it for minor cuts. The side effect is irritation, and you can use it 3 times a day. This one is very important. Mupirocin is an antibiotic. It's a topical agent. It's very good for Impetigo. This is what we use mostly, topical agent for Impetigo. What does it do? It causes burn and stinging after applying. This one to use this 3 times a day. But just remember, Mupirocin is a very good topical agent for Impetigo. For all these topical antibiotics, all the topical antibiotics, all of them, the key fact teaching that you have to provide the patient is when they need to wash hands before use. Okay, they may wear gloves and they have to apply it sparingly, not like a bunch of it, a little bit. Okay, and you, the nurse, you should watch for hypersensitivity. They should let you know also. If they start having irritation, they should stop it. That's all. This is all you need to know. Straightforward. That's all you need to know about this. This is mostly. Okay. Now, antifungal. fungal infection of the body. So for the body, the feet, and your hair, that's what we use it for. So we call them tinea, that's the pedis, that's your feet, crura, or corpora, your body. Crura is the groin area, body is the corpora, basically. Tinea, corpora, that's your body. How do you recognize this medication? They all have the last name ZORs at the end. So if you don't know at all, just watch for ZORs. You know that this is antifungal. Example is iconazole, right? Or clotrimazole. You see the last name? Yeah, those are the fancy name. Or you can have miconazole. If you can't recognize them yet, that's the look for the ZOR. Of course, nothing is perfect. There's some few of them that does not follow. Now, starting is an antifungal, but it's different. This one too, don't forget it. You see it in the test, yeah, it's an antifungal. Terbinafine, we use it all the time. It's very, very common. And then this, pay attention. This is for dandruff. It's also antifungal. If you have dandruff, selenium, it comes in suspension, sulfide. And it can be a shampoo or suspension, okay? It's a shampoo they add. So this is also antifungal. Okay, that's very important. These pharmacology, especially integumentary system, is just recognizing the medication. The questions are not hard. If you recognize it, you can pick it right away. Then you know this is antifungal. I have to use antifungal medication. What is the teaching you need to provide? All these things, you know, no need for dressing. So don't put dressing on it after application. You also have to protect your legs. So you wear shoe, protect your feet. So wear shoes when you're going out in the shower. You can use powder to keep the skin dry so that you don't have this infection again. Okay, that's antifungal. Antiviral. This is recognition. They're not going to ask you too many questions. They're used for herpes simplex, and where you have ulcers in the genitalia or vesicles, painful. They are very painful. And the way to recognize them is VIR. You look for VIR either at the end or in the middle of the medication. So that is the way to recognize them. Example is acyclo. This is the most common one they will give you. But they will give you etanoviral. They all have like VIR, looking for that. That's antiviral. Remember, antiviral medication can cause myelosuppression. So they can cause like aplastic anemia. That means your WBC is down, your platelet is down, your white count is down. So anybody on antiviral, pay attention for myelosuppression. Because you go to the bone marrow and suppresses the bone marrow from functioning. And so your red cell will go down, platelet go down, and then your white cell will also go down. So they have pancytopenia. We call it aplastic anemia. If you have herpes and you're using this medication, teaching is wear gloves. Don't use your hands. Okay, keep the area dry. And no sexual contact. So far as there's a lesion, no sexual contact until all the lesions go. The acyclovir is just going to slow down the progression, but it does not cure. Does not cure you of the infection. It's just the acute phase, it helps with the decrease in the duration of the disease process. And this is all you need to know. And how to recognize those medications, their side effects. Like I said, these are all straightforward medications. Okay. So let's get to the next one. So question 3, what do you think? Which prescription the nurse should what anticipate? A nurse is caring for a new client with what? Impetigo. What medication would they give? You know that Impetigo is a skin infection. It's usually bacteria, right? Therefore, Tebenify is antifungal. You see, it's all antifungal. Viral, what? Antiviral. And this is antibiotic. So I'm picking it. This is what we use. This is how you take this. Even if you don't know the problem, you say, oh, this is antibacterial infection. I'm not picking anything that is not bacteria. So I eliminate them and I'm left with this taking skills. And this is caring for a client with severe dandruff. And you said dandruff is what? Fungal infection. Which prescription the nurse should anticipate? I'm picking a fungal. Mafenide. This one is for burn. Okay. Isotretinoin. This is for acne. We will see it later. Selenium sulfide. Yes. Permethrin is for scabies or pediculosis. So this one. You see how this is the way they would say the question. If you recognize the medication, you can just eliminate it. Dandruff, I'm taking antifungal. And selenium sulfide is a form of antifungal, like I told you. Straightforward, right? The next one is scabies. This you have to master it, right? This is a parasitic infection. It's parasite. It lives on you. It's bad. It's caused by mites that burrow your skin. Okay, you burrow, make holes in your skin, into the skin, and they live there and they lay eggs, and you react. Reaction to the eggs is what causes the itchiness, skin irritation. That's all. So we got to get rid of this parasite on our skin. That's all. There is a couple of medication you have to know. There's 3 of them you have to know. Okay. Permethrin, Lindane, and Keratolytic. Permethrin, of course, you have to know. Keywords, all of them apply, I'm using capital, to dry skin. If they give you a question, is patient is wet already, is wrong. Apply to dry skin or dry air. That's very, very important when you're doing this medication. Okay. So for permethrin, I'm taking one by each one of them and giving you key fact. What do? You apply to the head to toe. Okay. You need to avoid the eyes. It can cause inflammation of the eyes and the mouth. So avoid that. Key fact, it has to be on for 8 to 14 hours. Then we clean it out or wash it out. That's key. 8 to 14 hours on your body, then you take it out. If people in your house have this, scabies, okay, so this is talking about scabies. If these people in your house have scabies, so this is all scabies. I need to put it there so that people are talking about scabies. Anybody who have scabies, there's key facts they can ask you. Their whole household should be treated, even if they have no symptoms, even if no symptoms. Everybody has to be treated. Your clothes need to be washed in hot cycle, really hot. cycle. Okay, that's very important. If you cannot wash it, then try to put in a sealed bag for 2 weeks so that you can kill all the eggs and everything if you cannot wash it. So that's a Permethrin. The Croton is the same thing. You apply it, you also stay on for 8 to 14 hours. You should avoid this, then you wash it out. But then you need to 24 hours later, do it again for 24 hours later, apply. But this time around, keep it for 48 hours, then wash it. What I mean, you apply one day, 8 to 14 hours, stop it, and wash it out. The following day, apply the whole 24, apply it for 24 hours and wait for 48 hours before you wash it. That's the key aspect of it. If they give you a Lindane, this is bad, but it's very good. The same thing you apply, then keep for 8 to 14 hours. But then there's a problem. These kids don't like it, so you should avoid it in kids. Okay, people who have seizure because it causes neurotoxic, causes seizures. So if you have seizures, you cannot use Lindane. It can also make you tachycardia, restlessness. Okay, it's like atropine, but you should avoid it in people with the seizures and other stuff. So that is Lindane, and this is scabies. This is the treatment for scabies. This is everything you need. If you know this for scabies, you're good. There's no question that will mix you both content and pharmacology. Now, his friend lies in your head, right? Anti-Pediculosis. It's the same thing. Make sure the air is dry or the body is dry so you can have it. So this is basically lice. You infect the scalp, which is the head lice. It can also infect the pubic area. We call it the crab lice. And this is the pubic area. It can affect your body lice where they affect your clothing. Okay. The same medications can be used. The same medication. The one is the Permethrin. Same thing. The same principle, right? 14 to 18 hours, then you wash it out. If you use Lindane, there's two types. There's two types of Lindane for this one. There's a lotion. If you have a lotion, the same thing. If you use lotion, usually 12 hours is good. Keep it on for 12 hours, then wash it out. If it's a shampoo, only 4 minutes, then wash it out. That's the difference. So Lindane fully like 12 hours for the lotion, then you wash it out. If it's a shampoo, just basically 4 hours, 4 minutes, then you stop it. And that's all. That's all you need to know how to use this medication. It's the way to use it in application. And I've given you the side effect of them. Okay. The Permethrin is just basically reaction, basically skin reaction, you get it. But this is very common medications. Okay, so that's those two. Let's try some questions. Number 5. Select other client. A nurse is caring for 5 new clients. Which client situation need immediate intervention by the child nurse? Scabies on Lindane and history of seizure, I told you. kit, neurological problems, seizures, yeah, we need to intervene. Pediculosis, using permethrin for 14 hours a day. Yeah, you're supposed to keep it on between 8 to 14 hours. So this is good. Pediculosis, using Lindane shampoo 4 minutes a day. Yeah, it's a shampoo, only 4 minutes. Scabies, using high temperature setting on the washer machine. Yeah, for clothes. Yeah, to kill all the scabies, the mites. Scabies, using Lindane 10 hours a day. Yeah, 8 to 14 hours. This is just to keep on emphasizing the key because that's what they want to is the for these questions is application. How is the patient going to use the medication? They are not hard medication, but teaching them how to apply it so that they don't have recurring disease. Very good. So the only one we need to intervene is one. The rest are all right answers. Now, next one, steroids, keratolytics, and the debriding agent. These are not, like I said, making this easy as much as possible. So let's take the steroid. We know we have topical, this is systemic, right? And they do what they get to do. What are they doing? Okay, they're doing preventing inflammation. That's all steroid is doing. Steroid, usually, they're there to prevent inflammation. So help with inflammation. And we can use them for like dermatitis, psoriasis, so many medication. Integumentary, so many things that you can use it for. What I want you to focus on is how to recognize them. Some or they have one at the neck, at the hand. Most of them. So them no, there's a metal son. You see, it's a son. Or hydrocortisone. Some people have problem recognizing medication. You see, they all have son at the last name. Try missing no what long, right? That's the way to recognize them. Some may have different name, but either they have son or on at the last name, right? So what is the biggest problem, side effect? I'm not going to go into endocrine, but for topical medications, just focusing on the key topical aspect of it, the skin will become thin, atrophic skin. The skin will change pigment. It will look like a vitiligo-like, so hypopigmentation. These are side effects you have to know. They will have striae on the skin. Okay. And the skin will look dryness. These are 4 things I don't want you to forget. Atrophic skin, hypopigmented skin, dry skin is common when you use the topical steroid. That's why you don't use it for a long time. They can have systemic manifestation. That means they get absorbed into your system, so you got to be careful. Especially if you have like high potency dose, usually like 1%, if you look at it, 1%, 0.5%, some people have 2, 3, 5%. So you got it, those are high potency steroids. So you got to know that if it's high potency, high potency, don't stop abruptly. Otherwise, you get a recurrence of your problem right away. Another key fact, do not apply to open wound. It will affect wound healing. Okay, so that's steroid. That's all, topical steroid. Then there is the keratolytic. All it means is it's breaking the keratin of the skin, okay, the cornea. Anything that on the skin is breaking it down. And what it's going to do is reduce the thickness of the skin. and it's going to soften the cornea, stratum cornea, and make it so anything stuck on your skin, you can break it down. Keratolytic skin, especially if you have people with actinic and keratosis, it will break the keratin. Okay, so this is a condition that you can use this medication for. There's a bunch of them. Example is fluorouracil. These are our topical enzymes. We have amino livolinic acid or imiquinoid. Like I said, these topical medications, if you recognize them, don't bother too much. Just recognize what it's used for. And then those that have side effects, I will give it to you. If they don't, I'll leave it alone. Alpha hydroxy acid. Pay attention to that medication. So alpha hydroxy, this medication, very, very important. Why did I say that? This is the last one is salicylic acid. This is what we use in cosmetics or lotions that we use for our body to prevent aging. Most aging medication women use to keep their skin fresh and they look young. All of them have alpha hydroxy acid. So if you see a question about skin product to prevent aging, yeah, skin product. All of them have alpha hydroxy acid. Okay, so these are the steroid really agent, and the last one is debriding. The debriding agent are not that difficult, as the name says. Look at it. They are debriding agent. What are they going to do? They're going to debride it. Debride the wound. Why are they doing that? They're removing dead cells, debris from the wound. Example is like collagens, collagenous medication. It's going to digest collagens for 10 to 14 days. You do that as it kills all the collagens down. Another medication is sutilene. This will take care of all necrotic tissue. We killed all of them, we destroyed them. Castor oil is also one of the debriding agents. It contains trypsin that break down protein. And it eat away all the dead tissue away. And that's all. Just know, be able to recognize it. They are collagenous agent, sutilene, and a castor oil. They are debriding. If you have a dead tissue on a wound, yeah, that's what you put in to kill away all the dead tissue. If you don't want to take them to surgery, this will be chemical debridement. They are not surgical debridement, they are chemical debridement. These are medication use, collagenous, sutilene, and castor. Okay, so what do we have? Question. Which products the nurse will recommend? A nurse presents to the dermatology, a client presents to dermatology clinic with what? Multiple warts on their hand. So they have a bunch of warts on their hand. What do you think they will use? Steroids? It's inflammation. There's no inflammation. Debriding, there's no necrotic tissue, dead tissue to debride on there. Antihistamine, there's no itchiness to deal with this. This is keratolytic, something on the skin. I'm going to cut it off, and I want something to destroy the keratin to make it smooth and soft. So keratolytic agent is what you're going to use. It's like you have to look at the words and play a word game with questions like that. Next question. Select or apply. A nurse is caring for a client with what? Unstageable pressure or injury. Which product the nurse will recommend to help stage the wound? I have unstageable wound, which mode would I use? Then you tell yourself, what is an staging wound? A staging wound is the wound that the wound bed is obscured by necrotic tissue and slough. So in order to take away all the slough and the necrotic tissue, I got to bring proteolytic agent, something that will eat away the tissue. You see the last word? So antifungal, topical clindamycin, antibiotic. This is for scabies and pediculosis. So you're left with the collagenous. You break all the collagen and acetylene, take away all the necrotic. So this and this are your right answers. Just to emphasize the concept I just present right now. Okay. Next one is psoriasis medication and acne. And these are biggies that you have to know. You have to know this. You know what psoriasis is, right? Very, very straightforward disease process. I'll give you the content. Usually they have plaques on your skin, and it's an autoimmune disease. The body is reacting with something you don't know. It creates chaos, and they have pruritic. It itches with some inflammation. So we have to control the immune system. There's a bunch of medication. There's the topical. This is a systemic that you can take by mouth. When it says systemic, by mouth. I'm not going to go list all the medication, but the key ones you need to know are the one I'm going to give you with their side effect. The first one is atropine. This is a topical agent that we can use for psoriasis. What is the biggest problem? It stains your hair, your clothes, and your skin. It can cause irritation also. Most of the time, we recommend use it at bedtime use. That's all you need to know. The next one is called Cotan. This is also a topical agent. It's also stain clothes, but it causes a photosensitivity. So because of that, we want to use sunscreen when you're going outside. It also has a high risk of skin cancer. So you got to be careful when you're prescribing these medications. If it's a topical agent, we can give it to them. Then salicylic acid is also a topical. This is a topical agent. It can be used in several areas. It softens new scales. It softens them and make the scales soft so that you can peel it off. What does it do? Not that big. It causes irritation or burn to the skin. That's a small burn. It's not irrelevant. It's not that important. The side effect is not a big side effect. The next one is CAC. I'm giving it to you because in case you recognize it in multiple choice, I know this is used for psoriasis. It's a topical agent. This is not a big problem. Calciprotrin. It's also a topical agent. These usually take a while, 1 to 3 weeks to work. Look at the name, calciprotin. That means it increases your calcium. So hypercalcemia. So watch for that. So they have side effect of hypercalcemia, constipation, all the side effect of high level of calcium. You have to know in case they ask you. You should be able to connect the dot. Bring your electrolyte and signs and symptoms that you expect in hypercalcemia. Right? Then there is this routine. This is also a topical agent. Okay, this is a vitamin A derivative. So they should avoid vitamin A. Otherwise, they get poisoning from it. You should apply it at bedtime and also causes photosensitivity. All vitamin A derivative Yeah, it causes photosensitivity. It's not bad. But the serious one is Stevens-Johnson syndrome. So you have to worry about it. Tell this patient they develop small purple rash on your chest here. The next medication is Acre. No, acitretin. This is a systemic, so this is systemic, so you got to take it by mouth. Okay, it's also a vitamin A derivative. Because it's going to your system, it's teratogenic. So you got to tell them you have to wear barrier method so that they don't get pregnant. Contraception. Also causes liver injury, and it raises your lipid profile, so hyperlipidemia. Those are the biggest side effects. But just know it's a systemic medication, it's a vitamin A derivative, and it's very teratogenic, so you have to worry about it. So use a barrier method in order to prevent and infecting your baby so that you don't get pregnant. Cyclosporin this is used for like transplant to lower your immune system so that you don't have rejection. I have a short video where I call it sportrin. Okay, this is very, very important. This is the side effect. So you get a skin cancer. Okay. So the P is basically pancytopenia. So this is a dangerous side effect. It's a dangerous. So I put a pancytopenia. That means you're the VVC, RVC, and platelet all down. So those are dangerous. You have to pay attention. That's a V-sharp moment for this medication. The O is oral, which is gingival hyperplasia. Don't worry about it. It's not a big problem. Okay. And the T is teratogenic. So you got to tell them to use barrier method. R is a renal, so it affects your kidney. Renal toxic. Okay. I is intolerance to glucose. Your glucose go up, but don't worry too much about that one. And it's neurotoxic, so you got to be careful. And E is elevated lipid level. So these are side effects for this medication. Very, very bad medication, but it's very good to help you control your immune system. To remember, the side effect is sportrin, and because of that, pancytopenia is key. Okay, teratogenic is key. This can also be key. But if they ask you a question, just pay attention which one they include, and these are side effects. You have to think about it. You want to but this is the biggest side effect of pancytopenia before the rest of them. That's not to remember then. Okay. Let me erase here. Next medication is methotrexate. This is also used for psoriasis. Methotrexate is also immunomodulator. Lower your immune system because it's GI toxicity, not that bad problem. But immunomodulation is good. It make you neutropenic. Okay, so neutropenic precaution. And you know what neutropenic precaution is, right? The same thing, cyclosporin, you got to do neutropenic precaution. No live vaccine, okay, no fresh vegetables, avoid crowds, don't drink from water fountain, okay. All those things you have to watch yourself and avoid infection as much as possible. So those are the keys that you have to pay attention to that. Okay. Psoriasis medication. The next medication is TNF alpha medication. There's a bunch of them, like infliximab. They all have the last name MAB, adalimumab. So they have this kind of name, etanercept. It's the only one that has some weird name, but these are all immunomodulators. What is the key? Same thing. They make you immunocompromised, avoid live vaccine. All you need to do is neutropenic precaution and avoid infection. That is the key. Avoid infection as much as possible for these medications. The biggest problem for this is you cannot start this medication without a PPD. So do a PPD, and if it's negative, yeah, then you start. If the PPD is positive, yeah, you cannot do it. But these are things you have to know for these specific medications and their side effects. Okay, so that's the psoriasis. Acne, the same thing. So acne, you have to know that there's different kind of acne. So there's a mild form of acne. That means there's few inflammation. There's a little bit of inflammation on the face from the acne and the lesions. And mostly you use a topical agent, very topical, small. They will describe it. They say, oh, small lesions, it's not that big. Mild acne, and topical agent is good. And what are the agents? Benzoyl peroxide. It's very good for mild acne. Side effect is stain your hair, your bed, and your clothes. It can make your skin dry skin. So you got to be careful. And it can irritate it too. Cyclic acids too can be used. It's also a topical agent that can be used for mild acne. If you have a moderate, that means it's more prominent. You have the blockhead. That's what we call blackhead. They call it, the another word is comedones. If you see them and they have like papules, yeah, those are moderate. As soon as you start having comedones, it's a moderate disease. This one is topical. Pay attention to this medication. It's not isotretinoin, it's topical treatment. What is the side effect? Photosensitivity. So wear sunscreen when you're going outside. Okay, that's the biggest side effect for that. It's not the same thing as isotretinoin. It's not that poison. Okay. Severe form means you have like inflammation. Now you've developed cyst, you have inflammation, bad comedones. Okay. Yeah, that's a problem. That's a systemic inflammation. Okay, so this one will require a systemic medication such as antibiotic and isotretinoid. Is different from tretinoid. So what is iso? This one you have to pay every word I'm going to say if you listen. Isotretinoid. This medication is a vitamin A derivative medication. It's teratogenic. It causes suicide. Because of that, teratogenic, we want you to wear condom. So you need to take oral contraception plus a barrier method 2 months before we start the medication. And you have to have negative pregnancy test ×2 before we start. And during, you should be taking both of them and wearing both of them. And after therapy. So all these things has to be met before. 2 birth control, 1 is a barrier method, 2 negative and pregnancy test before we start the therapy. And during the therapy, you should continue that. After, you should continue that. When they come in, you should check them for suicide. So you got to observe them, ask them questions, screening about their mood. So you got to do that, check their mood, so that makes sure they're not depressed. So that is key for this medication. Very, very. There's other side effects too that you should know about this. It causes liver toxicity. It's also photosensitivity, so you let them wear sunscreen. And then the issue where it also causes cheilitis, that means inflammation around your lips. Okay, cheilitis. It comes in capsules, so don't crush it. It causes dry mouth, skin, and eye. So they can use eye drops and sugar-free candy. They can have Emollient on your skin. Those are not bad side effects. So these are not bad side effects. This, of course, you got to don't crush it. This is not a bad side effect, not bad. This is dangerous. This is dangerous. So those are the ones you pay attention. Okay, so those are that medications. Of course, there's other topical antibiotic. I told you also that you have to know topical antibiotics that can be used. And example, clindamycin. Clindamycin, erythromycin, and dapsone. The oral, which is the systemic, is the same thing. Doxycycline, tetracycline. Minocycline, they all can be used for that. Okay, I will talk about tetracycline very shortly. The other topical one that I forget to list, in case you see them, they can be used for mild form, moderate form, is Adapalene. It's a topical medication. Azelaic acid or Tara. Azaroutine. These are topical. They're part of the Trenton group. Okay, so these are the topical agents. Tetracycline oral form is another one you have to know every word about it. This is used for systemic acne. Okay, these medications should be taken empty stomach, full glass of water. Okay, it causes esophagitis, therefore remain upright for at least 30 minutes after taking it. You should avoid antacid, they are never good. You should avoid iron pills, they are never good. Avoid food with it, don't take it with food. No dairy product. All this you have to know. It also causes photosensitivity, so have a sunblock available. Also teratogenic, or it make birth control ineffective. Therefore, you use barrier method. Okay, every word here you have to know about tetracycline. Trust me, it will be select or apply, and if you don't know, you can figure it out. And this is everything you need to know about acne. Okay, medication. So let's get to it. Try some questions. A nurse is caring for a client with severe acne. Which lab work is indicated before isotretinoin therapy is indicated? Select or apply. I told you, this is dangerous. It's very good, but you have to worry about it. It's teratogenic. CBC is not indicated. BMP, they need beta ACG. It does not affect your muscle. It causes hyperlipidemia also. So this and that. These two are something you have to know. It causes hyperlipidemia and beta ACG because it's teratogenic. So when you're on isotretinoin, we have to check your lipid profile and beta ACG. Something you have to know. You can answer any question based on this. Number 7. Select or apply. And this is caring for a client with what? Moderate. It's not severe. It's just mild. So moderate, usually topical agent. Which topical agent the nurse should anticipate? This is for mild disease. This is for mild disease. This is for severe. It's not topical. This is oral, systemic. Tazarotene is a topical agent for moderate, and Trenton is a moderate topical agent. These are your two answers. Number 8. These are short questions, straightforward, I made to emphasize the point I've presented. Which of the following is a priority and need immediate intervention? And this is caring for a client with psoriasis and prescribed cyclosporine. Cyclosporine is Sportrin, right? That is the side effect. Gingival bleeding gum due to excessive growth is gingival hyperplasia. It's not important. Glucose intolerance is not that important. Cholesterol, lipid is not that important. Neutropenic, pancytopenia is your biggest problem. White count of 3,000 is a problem. So this is the dangerous one. Trying to be like the examiner. Number 9. A nurse is caring for a client with psoriasis prescribed what? You see the map there, TNF-alpha, adalimumab. Which of the following teaching need immediate intervention? I will avoid Tdap vaccine. Tdap vaccine is not a live vaccine. So this is good. You should not avoid it. So this needs intervention. I will avoid fresh vegetables. That's good. I will need negative PPD test before initiation. Good. I will have water bottle during hiking. Don't drink from a water fountain. So the only one that need intervention, number 1. Number 10. The nurse is caring for 5 clients with psoriasis who need immediate intervention on cyclosporine, right? And taking oral contraception pills only. No, it's a teratogenic. Pill will not work. You need a barrier method, something that will prevent you from getting pregnant. So thus we need to intervene. On cyclosporine, beta ACG positive is teratogenic. You can't take them. You have a baby defected. On methotrexate and giving what? Nasal flu vaccine. Nasal flu vaccine is active. It's a live vaccine. You cannot get a live vaccine while on methotrexate. Acitretin is a vitamin A derivative, and taking 20,000 units of vitamin a day is not good. You get toxicity of vitamin A. On cold towel and complaining of what? Staining of the clothes. This is normal. So 1, 2, 3, 4, add your right answer. Select or apply. Sorry, add question. And this is caring for a client prescribed what? Tetracycline. Which of the following need immediate intervention? Taking the medication with full glass of water. Good. Using barrier method of contraception. Good. Using sunscreen during outdoor activities. Good. To prevent photosensitivity. Going to bed right after taking the medication. You need to be upright 30 minutes after taking it to prevent esophagitis. So this one needs intervention. The last one is anti-burn. The burn medications are very, very short. They are not a lot, and I'll make it easy for you. There's few of them. So Mafenide, Mafenide, right? This one is used to penetrate scar. So you can go through an scar of a burn, but the problem is it causes severe. It's also used for severe infection, right? It's very painful. It's one of those painful medications, painful 22 to 30 minutes after application. So it can be painful. It causes metabolic acidosis. So pay attention. This is key. This medication, when I give it to you, you develop metabolic acidosis. So pay attention. I have a question there. I'm going to emphasize. I'm not going to give the answer away, right? Next medication is sulfasalazine. So this is what we call Cifidin. It's the same thing. That's the trade name. This is painless. It does not cause pain when you apply it, but it makes you leukopenic. So you got to check the VVC. Very, very important. You should avoid it in the face. It's not good because it's scarring, too much scarring the face. It can cause skin necrosis because of that. Avoid it in the face. Okay, you should avoid it in people with G6PD, Cifidin. You should avoid it as much as possible. The next medication is silver nitrate. This is all for burn. This does not have any big side effect, just small irritation. That's all. And bacitracin, the last one, is also used for burn. This is good for the face. So if somebody have a burn and you need to burn to the face, you need to apply any agent to the face. Only one you can use is bacitracin. Don't use anything else. That's all. For medication, straightforward things you need to know about it. Okay? Let's do some questions and we're done. Number 11. A nurse is caring for a client with what, 30% burn to the torso. Mafenide was applied to the wound. Which of the following the nurse should anticipate? Buzzword, Mafenide. And this causes what? Metabolic acidosis. If you have metabolic acidosis, what would you think will happen to you? Respiratory acidosis. You start breathing very fast to get rid of your acidosis. Your pH is acidotic. It's not 7.9. It does not affect your blood pressure. It does not affect your saturation. So don't be trapped by this. I put it there to trap you. The individual will be hyperventilating. Just go with the concept you know. Don't get trapped. I know metabolic acidosis. What will happen to the patient? Breathing very fast to get rid of acidosis. They will be hyperventilating. Their rate will go to 33. That's your answer. So when you're seeing them hyperventilating, it's because we created metabolic acidosis. So 4 is the right answer. And the last question, hopefully. A nurse is caring for a client with burn to the face. Which of the following the nurse should anticipate? Concept, face, burn. Don't choose this, don't choose this, choose that, never this one. Number 3 is your answer. And this is the end of it. Thank you for sticking around. If you need more help, click down, subscribe, adapt NCLEX, and get content like this. All the best of luck. Thank you for sticking around. Bye-bye.